and I'm happy for you. And it just proves that we can't show everything with group studies, right? So some of you have done okay with that. But, all right, so that's pretty much the lecture. We can all go home now. Let's go to some details. Let's get a few details. This study gets kicked around a lot. This is a brain autopsy study with kids with autism or without autism who drowned. It came from Johns Hopkins, so you know it's right, because they never make mistakes at Johns Hopkins. They said that kids who drowned had a brain that looked inflamed if they had autism, but if they drowned without autism, their brain didn't look inflamed. That seems pretty straightforward, except it isn't, because the course after drowning varied a lot. And Dr. Casanova, who's sitting in the audience, was nice enough to say, you know, the pedigree of those brains is a little bit suspicious, and other people don't find any inflammation in the brain of kids with autism. I don't think they have to have inflammation in their brain, but I think their brain is going to respond to inflammation chemistry that gets there through a leaky brain barrier and influences it. It doesn't have to be inflamed, it just has to perceive the immune pathology that's taking place somewhere else in the body. So this is really nice and it's very dramatic, but it may not be accurate for most of your kids. Okay? I'm getting a nod from Dr. Casanova, so at least one person in the audience is happy that I said that. This is what it looked like, and this is the, oh my God. I looked at this paper as a father first, and I think I cried for about an hour after looking at this picture. This is the brain of a child who drowned without autism, and that's sad that any child would drown and we'd have their brain under the microscope. That's bad. This is a child with autism who drowned. Now, you would say, wow. In Yiddish, it's verschimmelt, okay? If you know the term. A few of you Jewish folks might pick that one up. It's bad, okay? Really, really bad. It's bad in a way that you're not coming back from. It's bad in a way that there's no recovery from, if that's the case. You may get some improvement in function, but kids who really look like that, they're not coming back. That flew in the face of what I know, which is that most kids get better and many of them recover fully. How can it be if this is really the nature of autism? That doesn't match up. This is too much pathology for the typical kid that I see. And you know what? Other researchers that had looked at brains in the past, they would recognize this degree of cell volume loss even without checking the immune system to see if it's turned on, and they didn't see it. They didn't see that kind of damage. It's much smaller, much more complex, but little bits of things that are deranged, not this huge disruption that you see in this study. So, however, they did get one thing right that I think is very important, which is this. That looks like there's a combat zone at the blood vessel interface with the brain. We call that the blood-brain barrier. And I really think that in many of these cases, that's under assault. Now, whether it's opening up and that's causing the immune cells in the brain to react more to what's happening, or there's a virus sitting there that's causing the immune cells to react, that's a critical area of intervention. So that's why when I treat kids with hyperbarics, which I use for this reason, because of this presumed assault on the blood vessels, I also use anti-inflammatories to reduce that inflammatory reaction. And we get much more sustained positive effects when we use those two together. Sorry, I haven't done that study, and I don't think anybody would ever pay for it. But that's how we practice. Dr. Theohardis did this. I'm probably really mispronouncing your name, so I apologize if I'm not even close. But okay, great, thanks. Anyway, autism and emerging neuroimmune disorder in search of therapy, and we are trying to find the right therapy. And let me tell you, the immune system disruption is complicated, and it's not that easy. He is working on some nice sort of combined natural substances, which is very cool to make that happen. And I'd like you to follow his research because I'm very excited about it. This was just published by a colleague of mine at the Imperial College in London. Jeremy Nicholson and I have sat at numerous think tanks over the years, and he did something that I think is extraordinary. He looked at the entire output of everything that was in the urine of kids with autism, their siblings, and kids that we called neurotypical. Every molecule. Because he has some of the highest quality, high-tech equipment in the world, NMR1, H1 equipment that can basically do that, and it's attached to a supercomputer that can say, this molecule is this, 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 this. And you know what? There's differences. It really comes down to this. I think that's pretty clear, isn't it? I'm kidding, of course, okay? That's the net outcome of the paper, all right? And you kind of need a supercomputer to figure it out, okay? The effect is that there's a whole lot of metabolism from bad bacteria in the urine of kids with autism that's not in the urine of healthy kids. Now, exactly what that's doing, we're not sure, but it's a great place to start looking. And it fits what I know clinically, which is if I clean up the gut, the kids do a lot better. They sleep at night, they stop stimming, they start to learn, and when that's off, they're off completely. This is the conclusion from the paper, but it'll show up on the DVD, don't worry about it. Now, this is a really fancy part of things, and this is basically saying that there's certain things that turn on that put kids at risk for losing brain cells, and it's critical stuff. I just want you to see the fact that scientists not associated with Dan or with crazy autism parents are looking at this and seeing the same thing that we think is going on. That's really what I want you to take home from this. You don't have to know what this compound is, but it puts the kids at risk for an inflammatory brain problem. Again, from Dr. Theohardis, mercury induces inflammatory media response in human mast cells. Critical stuff. Now, is mercury the only thing that does that? No. Does that prove that mercury causes autism? No. Does it say that mercury is a good thing? No. Mercury is a bad thing. It's on the top 5. It's one of the big ones that we know causes problems with kids' brains. Anyway, these substances, once we turn these on, damage the protection between the brain and the blood vessel, and normally the brain needs to sit behind a castle wall, just like a king and a queen on a throne, protected by their moat, the drawbridge, and the big walls. Now, if you know anything about battles in Europe, guess what? It didn't always work for the king so well. They eventually figured out how to break down the walls, and that's what's happening with the immune system activation, is figuring out how to break down the walls. So, neurodevelopmental effects of chronic exposure to elevated pro-inflammatory cytokines means the visual system doesn't develop normally. If you're chronically inflamed, your visual cortex won't develop the way it needs to. And do you think the same thing is going to apply to the auditory cortex, the hearing part of the brain? I think absolutely. And what do we have with our kids? Do they process things visually the same way we do? They do some weird stuff, you know, like they see things differently. I mean, I've given kids a shot of secretin before and that could talk, and they said, wow, I can see things now. There's not holes anymore. That's an intriguing observation from the patient. This is important. We have to address this chronic inflammatory syndrome, whether it's in the brain or if the brain is being impacted by it. We have to get that regulated as best we can as quickly as possible. This was excellent. I mean, how many of you read the stuff from the Chicago Tribune that basically said I was a bad doctor? Okay, thank you for being here anyway. God bless you. My wife thanks you. My partner thanks you. I'm sure Dr. Usman thanks you. Thank you for holding on to that, okay? I really hope that you hadn't, but, you know, at any rate. One of the things that I got really beat up, both on the telephone and otherwise then, was the fact that IVIG doesn't work for autism. There's no reason to use IVIG for autism. I have seen kids dramatically improved with IVIG. I know it works for autism. There's no doubt in my mind it works for kids with autism. Dr. Gupta just published this, which was wonderful, which is a rationale for treatment. And he did it. That's it. We need rational treatment, and we need to have a basis for why we're doing this, because, you know, right now, the studies are too complicated to do. But it's rational to do this in certain cases, and he went through the rationale for why to do it and how to do it. So, hey, I got defended a little bit by one of the best immunologists in the world. Now, we know that vaccines don't have any association with autism. It's just every time we do a study with animals, it seems that they do have an association with autism. And it seems that they seem to cause autistic features when we give vaccines to monkeys and other creatures, whether it's lab rats or whatever. So, and this was a study that was presented at IMFAR, and I think it's about to be published soon. If you didn't see Laura Hewitt's talk, that's another one that you might want to get. But essentially in this study, Dr. Walker, who may be here, but he's from Wake Forest down in the south, basically said, you know what? The histological changes in the inflammatory bowel disease of animals who get vaccines is dramatic, and they're turning